Myself, Dr. Bhartendra Sharma, professor from the Mahatma Gandhi Nursing College, and today I will be teaching about the topic coronary artery disease. So, as you know, that heart is one of the vital organ of our body. Heart uh, it pumps the blood which is necessary for all the cells of the body, and if heart fails, if any vital organ fails, that becomes a very risky for the life of the person. But in that, heart is one of the most, because as heart is affected, then ultimately respiration is affected, lungs are affected, and then brain and kidneys are affected. So if all these four organs are compromised, that can lead to the very complication of the patient. So such one condition is the coronary artery disease. So coronary artery disease means the vessels, the arteries which are supplying oxygenated blood and carrying the deoxygenated blood to the heart, to and from, carrying the oxygenated blood and bringing the deoxygenated blood to the heart. If the arteries uh, are blocked, then that can cause then this can cause a blockage in supplying the necessary nutrients or oxygenated blood to the cells, and this can lead to the even death of the patient if it is not treated timely. So what happens in this coronary artery disease? If the person takes the fatty diets or due to high cholesterol level, the atherosclerosis begins to form, and this atherosclerosis blocks the artery gradually, and it comes to the extent that it completely blocks the artery, and which restricts the blood flow, ultimately resulting in the heart failure or angina or myocardial infarction. So this is about the general meaning of the introduction of the coronary artery disease. Next comes this coronary artery disease is also known as atherosclerotic heart disease, atherosclerosis, coronary arteriosclerosis, and coronary heart disease. So the coronary atherosclerosis is abnormal accumulation of the lipid or fatty substances or fatty plaques in the lumen of the coronary artery, as I told earlier. So this happens because when the patient takes more fatty foods or high cholesterol diets or lack of exercises, cigarette smoking. So because of this, the atherosclerosis begins to develop, and as it develops more, it blocks the artery completely. So next comes the risk factor. What are the main risk factor for the development of this coronary artery disease? So the risk factors are divided into two. First is the modifiable risk factor, and another is the non-modifiable risk factor. So let's see one by one. The modifiable risk factors, these risk factors are the one which can be modified by the lifestyle changes or by the change in the practices of an individual or the patient. So the modifiable risk factors are high cholesterol level. So as I told earlier, the main problem for the development of coronary artery disease is the high cholesterol level. It happens because of taking high oily foods, taking high fat diet. So because of that, so this should be minimized. Second risk factor is the cigarette smoking. Okay, so cigarette smoking, if it is minimized, then this can also this can be modified. So the occurrence is reduced. Next is the hypertension. So hypertension is modifiable; it can be reduced. Next, diabetes mellitus. Diabetes mellitus is a biggest concern because it affects almost all the cells of the body. So diabetes mellitus is also preventable. It's not curable, but preventable. If diabetes mellitus is prevented, then hypertension is prevented, and ultimately the cardiac disease and certain neurovascular disease, that also can be prevented. So diabetes mellitus should be kept into the control. Next is physical activity. Most of the time patients or individuals, they are not exercising, and such a today lifestyle also, when we are going, people are having computer job, sitting and working. So in that, physical activities are very much restricted. So that can also lead to high level of cholesterol, because activity pattern and exercise patterns are reduced. So this can also be modified. So the more and more the individual or patients are instructed to do the exercises. And the last is the obesity. So this is also related to the activity or exercises. The more the persons are obese, the more the health problems they have. And one among them is the development of atherosclerosis. So the obesity or the dietary pattern of the patient should be controlled. So these are the certain modifiable risk factors. So the patients should be instructed that they have to control on all these modifiable risk factors, and if they control these aspects, the most of the chance of occurring the coronary artery disease is minimized, because this lessens the modifying the lifestyle means that lessens the development of atherosclerosis in the patient, and there will be less occurrence, less chances of occurrence for the coronary artery disease. Another risk factors are the non-modifiable, which cannot be modified, and these are the family history of coronary artery disease. Someone in the family genetically they have their fathers or siblings, so that cannot be modified. So the siblings also have to suffer for that. Increasing age. So as the individual age, each cells of the body starts degenerating, and the heart cells also is one of them. So their functions becomes lessened, and they are more prone. They become more prone to develop the atherosclerosis. And next is the male. Male persons are affecting more compared to the female. And another is the race. That is the non-white population people. They are also affected more by this coronary artery disease. So this we discussed about the risk factors, which are grouped into two, that is modifiable and non-modifiable risk factors. Next comes the important topic, that is the pathophysiology of this coronary artery disease. So what happens in this coronary artery disease due to this etiological and risk factor which we discussed? If they are not properly controlled and the patient goes with them with the whatever extent he goes with them, so this lead to the breakage in the endothelial cells in the lining of the artery. So once that injury of the endothelial happens, inflammation and immune reactions becomes in the endothelium, and this causes the lipid to accumulate in the arterial wall. And as these lipids carry on accumulating, so by this it becomes hard. This atherosclerotic plaque becomes hard, and sometimes it becomes so hard or so much increased that it completely blocks the artery, and sometimes it's a rupture also. So when it blocks, so there is no supply. So in that case, the patient may develop angina or pain or infarction, or even the shock condition also the patient may get, that myocardial infarction. And if they bleed itself, so that may lead to the formation of thrombus also. So this is about the pathophysiology of this coronary artery disease. Next comes the signs and symptoms. So the main sign of this coronary artery disease is the patient, because the patient reports chest pain frequently. As we know that the atherosclerosis has increased, atherosclerotic plaque has increased, and it has completely blocked the lumen of the artery, and this is blocking the blood to go forward. So by that the heart is not able to supply the artery is not able to supply the blood to the particular tissue, so they are getting damaged, they are getting necrosis. So by that the patient gets pain, severe chest pain. So this pain is also referred to the angina pectoris. So different types of chest pains are there, angina are there. So the patient report mainly the chest pain. Next comes the myocardial infarction. The patient may develop the acute, if there is sudden blockage of the heart, sudden blockage of the artery, so the patient may get the heart attack also, that is sometimes referred to as myocardial infarction. The patient may develop diaphoresis, increased sweating throughout the body due to this coronary artery disease. Next, there will be changes in the ECG, all the level of the ECG, that is PQRST. So in that ST segment there will be depression either or the elevation. So this may lead to various dysarrhythmia, either sinus tachycardia or sinus bradycardia or atrial fibrillation, depending upon the severity of the lumen has involved. So these are the ECG changes and dysrhythmia. Then the patient may feel the chest heaviness, very tightness, chest tightness or chest heaviness because of pain and this one blockage of the artery. The patient may report that he is feeling heaviness of the chest. Next, the patient may have difficulty in breathing, severe difficulty in breathing. And next will be the fatigue. The patient will be very much tired. So this will be the clinical manifestations. And next comes the diagnostic evaluation. So diagnostic evaluation, the most important is the history collection and physical examination. So in the history collection, we have to give more concern on identifying the risk factors about the, as earlier we told, modifiable and non-modifiable risk factor. So we have to ask the questions to the patients which emphasizes that what is the prominent reason, how it develops how the patient develops the coronary artery disease. So such questions we have to out about the lifestyle, about the eating pattern, about the working pattern. So with these clues, we will come to know that what is the reason how the patient has developed the coronary artery disease. Next comes the physical examination. So in the physical examination, we have to do the complete head-to-toe examination and systematic examination. So in the head-to-toe, we will find out what are the different abnormalities, and we will mainly focus on the hypoxic part or the cyanosis part or any abnormal things the patient may be reporting. And main will be the systematic examination. In the systematic examination, we will be assessing the, first of all, heart. So in the heart, we will check the ECG pattern, that PQRST, how the ECG, how the patient's ECG is reporting. So in that, what type of dysrhythmias it is there, sinus tachycardia, sinus bradycardia, fibrillations, or atrial flutter. So what type of ECG patterns are there? So we have to recognize that, and the type of dysrhythmia the patient is having, we have to note that. So that is the one point in the systematic examination of the heart. Next, we have to see the vital signs, that is heart rate, BP. Okay. So initially, it is reported that the patient at the time of heart attack or the chest pain, the patient may be having high BP, but gradually it because it is a body response to the abnormal pattern. So the first of all body tries to defense. So in that case, the BP may increase, but after that it may fall down. The patient may become the hypotensive. So in the heart rate we have to monitor, in that there will be variations, and in the BP there will be variations. Then we have to look at the tissue perfusion. Tissue perfusion mainly at the tongue, we have to see whether it is pallor or there is cyanosis is there, and in the fingernails we can check by pressing. So in this way we can check the tissue. Eyes we can check if there is pallor. So by that we can analyze that tissue perfusion level is to what level. Next comes the respiratory status. So in the systematic examination, first we look at the heart, the next respiratory status. So in the respiratory status, we have to first of all see the oxygen saturation. So as we see that if the heart is not functioning, it will not be able to supply the blood. So directly it will influence the respiration, because heart and lungs are working together. So there is chances that the patient oxygen saturation will fall down. Patient will be hypoxic. So patient oxygen saturation should be checked. ABG should be checked, and after ABG, the patient respiratory status to be monitored. Then next is the systematic examination, brain. So in the brain, we have to look after the level of consciousness of the patient, because the heart is not supplying the blood. So immediately the patient level of consciousness, because brain is also vital organ. So the brain should receive oxygenated blood timely. If it is not receiving from the heart, because heart is not pumping the blood properly, decreased cardiac output. So this will influence the brain functions also, and in that we can see the level of consciousness, patient level of consciousness will be altered. So that we can check by the Glasgow Coma scale. And next, if the patient is means unconscious, falling unconscious because of this heart attack or severe due to complications like heart attack or heart myocardial infarction. So in that patient reflexes also we can check in the nervous system assessment. Another systematic examination comes the kidneys. So kidneys, because majority of the cardiac output goes to the kidney. So if the kidneys, if the heart is pumping less, decreased cardiac output, so it will indirectly influence. It will directly influence the kidney functions also. So kidney will be getting less blood. So there will be, the patient may go into the acute renal failure if not promptly action taken, and the patient potassium level, sodium level, creatinine level, all these level will be altered, and the patient urine output will be decreased. So all these things we have to assess in the systematic examination of the in the systematic examination. Next comes the cardiac enzymes. In the cardiac enzymes, troponin T level to be measured, myoglobin level that to be measured. So cardiac enzymes to be checked, electrocardiograms, as I told earlier, echocardiograms to detect any structural deformity in the heart, then stress test. Stress test, this is done mainly on the either on the cycle or on the treadmill to rule out the functions of the heart. And next, nuclear imaging tests or angiography. This can be done to get a complete picture about the structural damage or the inside the arterial structure picture of the heart. So this includes the diagnosis. Next comes the management of the, so the management in the coronary artery disease include administration of anti-anginal medication. So anti-anginal medication like nitrates, beta adrenergic blockers, calcium channel blockers, AC inhibitors, statins, imipenem or analgesics are given for this in the drug therapy. Next, surgical intervention includes angioplasty, stents, coronary artery bypass graft or PTCA. So this are the different surgical interventions are available. So this can be taken according to the severity of the patient. Coronary artery bypass graft, in there the artery which is blocked, so the bypass channel is created, and by that the vessels which is not completely blocked, it is bypassed to that artery. So in this way, coronary artery bypass grafting, this is a open procedure and big procedure that can be adopted. Then besides that, angioplasty is there, stents therapy and PTCA. These are less invasive procedures that can also be taken into consideration. Next is the complications. Complications. So as I told, complication, if the patient is not brought to the attention, then due to this coronary artery disease, the patient may get into the shock condition, that is cardiogenic shock, and if not timely interventions taken, the patient may die also. We have seen so many such cases that the person is working and suddenly he got the heart attack, and he kept there itself, not taken to the hospital, and he died. There are so many examples like that. People are working, and if they are not taken timely consideration, so the patient may lose the life. So immediate attention should be taken for such patient, and the patient's success rate depends if they are brought to the timely to the hospital and proper first aid management is provided to them. So this is about the coronary artery disease. Thank you very much.